Osteoporosis is a disease where the bones are getting brittle, and that brittle bone disease leads to increased risk for fractures. It is very commonly seen in postmenopausal women. Once the estrogen is depleted, the bone turnover goes up very fast, and the cells that are resorbing the bone and eating away become very active. 1 in 2 women over the age of 50 are likely to fracture from osteoporosis. So it's a very prevalent disease that carries very high morbidity problems. There are roughly 750,000 vertebral fractures that happen every year in this country. 250,000 hip fractures happen in this country from osteoporosis. Men are also equally likely to get osteoporosis, especially once they get past the age of 70. So it's not just a female issue, it's a very common issue, especially as we're getting older. Here we use tests like bone density to catch patients' status of their bones, and we utilize that to diagnose the condition because patients with osteoporosis don't have symptoms. So they're not going to complain to us about osteoporosis. And the only thing that might lead to thinking about osteoporosis is a fracture. But as physicians, we want to prevent a fracture. We want to catch them early, so we utilize tests like bone density to screen patients, and if we find patients are thinning their bones, make sure they do something good for their bone health. And that could mean taking proper calcium, taking proper vitamin D, making sure they quit smoking, they cut out risky behaviors that are contributing to their bone loss. Exercise is very key to their bone health also, so I once again stress to them to walk regularly. Fall prevention, one of the common causes of fractures is falls. So I spend some time educating them about fall prevention. And there are a lot of new drugs that have come for the treatment of osteoporosis. So I make sure that if they need those medicines, that they're on the right medication as well.